I'm Tom Schaller. I work for Steadman Hawkins Clinic of the Carolinas, and my specialty is orthopedic trauma surgery. I take care of people in the Greenville area, including Powdersville and Easley. I decided to get involved in medicine probably in high school. I always had an affinity for science and math, and I thought that maybe medicine would be for me. I happened to break my wrist when I was in college. I got to know an orthopedic surgeon at that point, and that really cemented my interest in medicine and eventually in orthopedics. I grew up in the Chicago area, went to high school there, and then moved on to Miami, Florida for college at the University of Miami. From there I went back to Chicago in order to do my medical school training at the University of Illinois of Chicago, and then I moved on to Michigan State University in Kalamazoo in order to do my internship as well as my orthopedic residency. After my residency, I went to Carolinas Medical Center in Charlotte, and then afterwards I returned to Kalamazoo, Michigan, where I was a practicing traumatologist for 6 years. After 6 years, I decided I'd like to move back to the Southeast, having a wonderful experience in Charlotte, and I was fortunate enough to get a job here in Greenville with Steadman Hawkins Clinic of the Carolinas. Well, I do a fair bit of general orthopedics, which involves simple surgeries to complex musculoskeletal surgeries, but my favorite things to do relate to orthopedic trauma and fracture care. So fixing fractures that require better alignment or better positioning in order to restore the normal function of the human body. I think that if you come to see me with an orthopedic injury that requires surgery, I think that you're going to be in very good hands. The reason I would say this is that my training at Carolinas Medical Center is one of the premier trauma fellowships in the country, and the experience that I gained there, that I carry with me on a daily basis, really sets me apart from the average orthopedic surgeon in terms of my skill and my knowledge in dealing with orthopedic injuries. Probably what patients don't see behind the scenes is the time that I spend preparing. I'll often, a day or two in advance of the surgery, I will sit down and map out how I feel their surgery should go. I'll sit with their x-rays, and I'll review an anatomy text if I need to really make sure that I am fully comfortable and that I have a three-dimensional roadmap of how I'm going to perform their surgery. I'll often write it down and bring a written plan to the operating room so everybody in the room knows what we're doing and why we're doing it. All of this happening while they're asleep, but they should feel confident knowing that I've prepared and I've made sure my team is prepared so that they have an excellent surgical outcome. I think being an orthopedic surgeon with Steadman Hawkins means a few things. It means that you put patient care first. It means that you're a scholar, and it means that you're a researcher. We have expectations of each other here in this group that we will provide outstanding care to our patients, and that we hold each other to a high standard in terms of maintaining our continuing education and continuing to contribute to the research, the body of research of orthopedics. I have a huge passion for mixed martial arts. I follow that quite a bit. My background involves a fair bit of martial arts training, and so all through high school and college I was involved with martial arts, and although now I don't practice much anymore, I certainly enjoy watching it and following it, and really an avid lover of mixed martial arts. I enjoy living and practicing medicine here in Greenville. It's such a beautiful city, and the people are so warm. My wife and I have just loved it since we've been here, and certainly we both love the change from the typical Michigan weather. Probably the most rewarding thing for me about being a doctor, particularly in orthopedic surgery, is restoring function to someone who's got a musculoskeletal ailment, or more often a musculoskeletal injury. Taking someone who was relatively high functioning, maybe even an elite athlete who is doing great one day and then something unfortunate happens, I can be there to help get them back to that level that they were at before the injury occurred. And it's really rewarding to see someone from that initial evaluation where things aren't going so great and guiding them through their care, whether it be operative or non-operative, and getting them back to seeing them, at their final appointment, giving them a good handshake and seeing them go on their way, really feeling as good as they did before they met me.